I'm Brian. This is Kathleen. And tonight we're going to talk about a couple different things. You see, what happens is me and her subscribe to two different sides, okay? I'm a little more right. She's a little bit more to the left. We agree on a lot of shit, but we argue about everything. So we're just going to go over a few things and talk about it. And, go from there.
Okay, so what brought upon this argument was two things. Donald Trump's ban of transgender people in the military, and something else I saw on Facebook that I just brought up to Brian. What Donald Trump said specifically was, after consultation with my generals and military experts, you guys probably heard what he said, but he said, consultation with my generals and military experts, please be advised that the United States government will not accept or allow transgender individuals to serve in any capacity in the U.S. military.
So they're kicking them completely out.
Yes. Our military must be our military must be focused on decisive and overwhelming victory and cannot be burdened with the tremendous medical costs and disruption that transgendered people in the military would entail. Thank you. And that's what he said. So that was one part of it that we can talk about. And there's a second part that we could talk about, and this is something that Brian and I disagree upon. This is something I saw on Facebook. It's something I saw on Reddit that Brian and I spoke about. This is something that someone said. I'm not quite sure where it came from because it came from, I saw it on Reddit and Facebook. Until we can afford prosthetics and equipment for every wounded warrior, we have no business paying for sex changes. I completely disagree with the fact that we should not have transgender people in the military, and I completely disagree with the fact that we should not be, in terms of medical care, paying for sex changes.
Yeah, I mean, here's the thing, right? You want to pretend you're a woman when you're a man, or vice versa. I don't give a fuck. Call yourself a robot. If you want to pretend you're a fucking unicorn, I personally don't give a shit. But what I do give a fuck about is my money, okay, my tax dollars going for essentially what I believe is elective surgery, okay? Because if you want to change yourself into a man or a woman, vice versa, do it on your own fucking dime. I don't want to pay for it. There's no reason I should. If you want to serve in the military, that's fine. I could give two fucks. But I don't want to pay so that way you can get yourself a boob job.
Well, can I bring up a point to you? And I did. If anyone's watching this, I did warn him I was going to bring this up. There was a study commissioned by the Department of Defense, and they said this was a study commissioned by the Department of Defense. It was done by the RAND Corporation. It's a .org. You can look it up, and maybe we could put the link up there. They said the worst case scenario that it would be 0.13% increase in spending, or 8.4 million. Again, that's million, not billion, but $1 million in spending. But that's the worst case scenario. It could be as low as $2.4 million in spending for transgendered people. In other words, so the lowest number could be $2.4 million, or 0.04% of our budget on people who are transgendered. This was commissioned by the Department of Defense. And
listen, it could cost $50,000 to get every GI a cock enlargement. I still ain't fucking paying for it.
All right, well, the military spends $84 million annually on erectile dysfunction medication. $84 million annually. About half of that is on Viagra. Do you think we shouldn't pay for Viagra?
I don't think Viagra is something that, as a taxpayer, like if your old man can't get a hard-on, why the fuck is that my responsibility?
Okay, so what else do you think we should not pay for, dear?
I mean, realistically, I believe that, the VA hospital should pay for, anything impertinent to your health care. Now, transgendered surgery.
What about Viagra, which makes up $40 million roughly? It's a little bit more than that, but I'm just going to go with $40 million. You don't think that they should pay for erectile dysfunction medication?
No, I don't think you should. I don't think they should pay for.
So they shouldn't pay for this.
No, I mean if you can't.
These people are dying for their country, and you don't think they deserve a fucking hard-on?
Well, listen, if you can't fuck your old lady, that's not. That's up to you. I mean,
these people are going to different countries. And Brian doesn't think that they should be able to get a fucking hard-on. They shouldn't be able to go home. Okay, so they're gone 9 months out of the year. The 3 months or whatever that they're home out of the year, they can't get their dick up because they need medication. Brian doesn't think that we should pay for it. These people are fucking dying for us. Brian doesn't think that they deserve a boner. That's quite unfortunate.
My question is this.
Isn't every man entitled to get a boner if he's going to die for our goddamn country?
All right, you know what? Maybe, all right.
$84 million compared to the $8.4 million, and that's the maximum that we might spend on transgender reassignment surgery. The lowest amount is probably $2.4 million. Okay, so $84 million so people can get it up and fuck their wives. I think men are entitled to that. What? And you know what else? I think that people are entitled to be happy and have hormones or have whatever they need to be happy. And you know what? Donald Trump had 4 fucking deferments during Vietnam. I don't give a shit if you are, as I would say, someone who is genderqueer or someone who is non-gender binary. You'd probably say a dude with a clit or a chick with a dick. That's probably what you would say. But I would say if you want your balls cut off, you get your balls cut off, and you want to fight for our fucking country and you want to go die for us, you have a bigger set of balls than our president does. That's what I'd say.
Well, I'm not going to disagree with you on the semantics of that. I mean, quite frankly, I do believe that Viagra, paying for Viagra is a far more important thing to pay for than gender reassignment surgery. I will agree. I will switch my position. Okay, so paying for the Viagra for our soldiers, you know what? I'm down for it because you know what? They do deserve to fuck their wives if they can't get it up anymore. However,
transgender people don't deserve to not want to die. And I can also tell you, however, out of all of the people that want to get transgendered surgery, it's very tough to estimate, but there are around 1,300 to 6,600 transgendered people enrolled in the military at any time. It's hard because there's a lack of empirical data. A lot of them don't want to cop to it, I'm sure, because of... Well, yeah, because people like you are, judgmental.
I'm not judgmental. I say they should be able to serve. I just don't want to pay for their fucking boob job.
No, it's not about a boob job, though. It's not about a boob job. It could be hormones. In your mind, no one's saying they need to be Caitlyn Jenner. No one is saying that they need to get a tit job and they need to get facial reshaping. But if they want hormone therapy, the DSM-5 has recognized gender dysphoria as not a disorder, as not a mental illness, but as a legitimate medical problem.
Yes, I just don't agree with that.
Gender and sex why do you not agree with that?
I don't agree with it because, listen, to me, it's a preference. That's
It's
your
not a
preference.
preference. Who would choose that, Brian? Who would choose that?
Probably because it's popular right now.
No, it's not popular.
It used to be popular to be gay, and now that's like taking like a back seat, like to transgendered people. Like if you believe that in your heart,
It's not popular. Do you know how many transgender people get murdered every year?
you know how many gay people used to get murdered. You know how many black people. You know how
It's
many white
not
people get murdered.
Well,
Like
being black and white, you can't change if you're black and white.
it's
but
something. Well, yeah, you could. Hey, listen. Maybe I identify as a black guy. So what I'm going to do is I'm going to go and get melatonin treatment, and I'm going to darken my skin color because I identify as a black guy.
If
So
I
should
can
the
tell you-
military
okay,
pay for that?
Did you hear what I said about the budget?
Yeah,
It's
it's-
less than
okay.
1% of an increase of the budget. These people are willing to die for our country in whatever war we should happen to fight. Do you really think that these people don't deserve the best?
Yeah, well, they're not even allowed, per Trump. You said right, they're not even allowed in the military anymore. So it's a moot point, right?
There is a soldier.
The fucking cat just walked
There is.
back through our green screen.
I don't give a shit if the cat walked through our green screen. There are soldiers that have said, I want to keep fighting, even though Trump said that I cannot. There's a soldier, I have to look at my notebook to fucking remember the name, but,
Well, regardless, some dude with a fucking vagina, you know?
well, you can say a dude with a fucking vagina because you're being flippant and you're being dismissive, but he was a veteran of Afghanistan, and
Okay.
he's been fighting for 13 years, and he said, even if Trump abandons me, I will not abandon my country, and I'm going to keep fighting, even if he will not fight for me. Donald Trump promised in the elections, he said, I will fight for the LGBT